My name is Dr. Courtney Conley, and I am a chiropractic physician. I grew up as a ballet dancer, so I was shoving my feet into point shoes all the time, and then I transitioned into being a triathlete. So swimming, biking, running, cycling, and really never paying attention to strength training, let alone strength training my feet. And so as a result of that, I had bunions, hallux valgus, Taylor's bunions, neuromas, kind of the whole bit. So it was a personal quest of mine to figure it out. I realized at a very young age that movement was my key to sanity. So I didn't want anything preventing that. So that kind of transitioned me into different footwear. My foot started to get stronger. I brought that into my clinic, and here we are. It's been the last 15 years of my life looking at how do we get someone stronger from the ground up. If you think about the cutaneous receptors, so all these receptors on the bottoms of the feet, they're dying to feel things. If you think about a baby, every baby on the planet just takes their shoes off so that they can kind of feel the ground. They want to drive information to their brains. The way the foot was designed, the structure of the heel, for example, was designed to hit the ground. So we have all of these bones in the foot that were designed to handle load. So we have this beautiful neurosensory system. And then you have all these bones that were designed to handle load. And then you have 4 layers of intrinsic muscles that live within the foot, not to mention extrinsic muscles that feed into the foot. So if we have all these muscles in the foot, we need to use them. So our foot hits the ground and it basically drops down and comes back up. It's like this recoiling effect. And we need to have that for efficient movement. So I think the industry is changing quite a bit, because for so long it was anti-pronation, and I need a really aggressive orthotic, and I need this shoe that's going to block all of this motion. In the majority of my patients, I'm teaching them how to find pronation. And that involves getting a foot stronger. So if we're not strengthening our foot to be able to handle the shock absorption of pronation, and we also don't have the capacity to get out of pronation so that the foot can then propel us forward, we have problems. I think it's a misconception that when things hurt, so if I have knee pain, for example, I must need to go get a shoe that has a lot of cushion, because it must cush my body when I walk. And that's just not what happens. When we put more cushion underneath this beautiful heel that was designed to absorb shock, we can't feel anything. So when I'm walking and I'm overstriding, or I'm hitting the ground really hot and heavy, I can't feel anything because I have all this cushion here. And that means if I hit heavy, more ground reaction force going up through my body. So in fact, it's quite the opposite. You want a shoe basically to allow your foot to do what it's supposed to do, which is unlock, which is basically to change shape. You want your toes to be able to splay. So when we have footwear that takes away all of those things, that becomes a problem. So this is the Vivobarefoot Modus Flex. This is a minimal shoe. It bends, it twists, the heel and the toes sit on the same plane. So when your foot is in a shoe like this, it has to work harder. There's more load going through your tendons. The muscles are working harder. There's more loads going through the bone. That's not a bad thing. And there's some things I just wanted to talk about here. First and foremost is the toe box. I think that a wide toe box is probably my biggest non-negotiable. When we are talking about transitioning people from their, very constrictive footwear or motion-controlled shoes into something that is more functional, that is the first place I go, is making sure that the toes can splay. The other thing is the heel to toe drop. So in a walking gait, like I said, we want the heel to strike the ground, and then it's like this beautifully designed rocker. So those are some of the kind of characteristics that we look at with footwear when we're trying to get people to move like they were designed to move, to walk efficiently. Everyday footwear, we need to work on getting into something like this. where your foot can handle being in a position where it wants to work. I really think that the footwear selection, and importantly in conjunction with foot strength, is really going to see changes for people.